Phenylketonuria is a disease that affects mental retardation. Other names for phenylketonuria are listed. The most common one is PKU. The name was chosen because lots of phenylalanine in the blood leads to increased levels of phenylketones, which are found in the urine, hence the name phenylketonuria. In 1934, a mother came to Dr. Folling with two mentally retarded children. After further testing, he proved by organic chemistry that both kids excreted phenylpyruvic acid in their urine. Later, he also found the same substance in 8 other mentally retarded children. After further research, Folling discovered PKU was an autosomal recessive disease, most likely caused by a block in phenylethylamine metabolism. PKU is inherited in families in an autosomal recessive pattern. Each parent must have one recessive allele to pass down to their offspring. The child must be homozygous recessive to show symptoms of the disease. Here's a pedigree showing the probability of 2 carriers having a child with PKU. On the right shows chromosome 12 with the PAH gene, also known as the phenylalanine hydroxylase gene. Mutation in the PAH gene causes PKU. Symptoms range from mild to severe. Infants born with PKU don't show symptoms for a few months. Without treatment, they could develop mental retardation, behavioral problems, seizures, developmental delay, light skin and hair, and possibly eczema. Some babies are born with a milder form of PKU and don't show symptoms at all. The primary effect of PKU is mental retardation. Without treatment, the patient's IQ scores would be noticeably lower than a patient on treatment. In the United States, newborns are screened for PKU. Blood spots are collected on a screening card that is sent to a screening laboratory in their state. If high levels of phenylethylamine are found, then another test is done to make sure the first one was right. The parents are then notified of their results. Prognosis for an untreated patient is normally poor, but 2 to 5% can live normally without treatment. With treatment, prognosis is good with normal intelligence. Patients must continue the low phenylethylamine diet or IQ scores might decline. The decline of IQ scores is based on how long the patient has been off the diet and what age they stopped it at. The person with PKU is affected in stressful situations. In school, they might be marked down for deviant behavior. Family members must watch their young kid's diet to make sure the kid follows the guidelines. The treatment for PKU is a low phenylethylamine diet. The diet should start as soon as the baby is diagnosed. Special formula is made for the baby that adheres to the diet. The patient should stick to the diet for life. Without the diet, IQ scores decline. PKU has always been treated with this diet. Cuivan has been approved for the FDA to treat PKU. This drug aids in breaking down phenylethylamine but is still being tested for safety. Researchers are investigating the use of gene therapy where they would inject new genes to break down phenylethylamine. Large neutral amino acid sublimation has been tested to block the flow of phenylethylamine into the brain, and enzyme replacement therapy has also been tested to replace the enzymes that should break down phenylethylamine. The purpose of the National PKU Alliance is to improve the lives of individuals with PKU and to pursue a cure. Gene and cell therapy have been tested. Although the therapy has worked in mice, some immunosuppressant medications have also been needed. New techniques have shown promise, like using heterologous tissue approach. Enzyme substitution could be a cure in the future because enzymes in plants and bacteria have been found that can replace our enzymes. Their other main research topic is hepatocyte transplants. This is when bad liver cells are replaced with unaffected liver cells from a donor or stem cells. There are 2 possible Punnett squares of parents with affected children. The orange genotypes are the possible results of the cross that would be affected. Tracy Elbeck was tested for PKU like all other newborns. She was put on a diet at 3 weeks of age. She graduated high school with a 3.55 GPA and a love for science and math. She then went on to graduate at UCLA with a bachelor's degree in astrophysics. In spring of 2001, Tracy became the first person with PKU to earn a PhD in astronomy. She has gone all over the world with learning more and more about astronomy.